We'll talk with an expert about how early detection of breast cancer can save lives.
So if you feel something, even if you've had a recent mammogram that is normal, please don't ignore it.
Then we'll learn how one organization is helping Central Floridians and their families battle breast cancer.
Our programs for breast cancer patients have gotten a lot better. We've put a lot more checks and balances in them to make sure that patients have a smoother ride.
But first, one local survivor shares her story of empowerment.
I just want to be here as a beacon of like, okay, this is what it's like. This is life after breast cancer.
In honor of Breast Cancer Awareness Month, we'll talk with 3 Central Floridians about women's health. All that and more next on Metro Center Outlook. Hello, I'm Diane Trees. Breast cancer is the second leading cause of death among women in the United States. Today we'll talk about detection, treatment, and advocacy. First, Linda Schulte, an 8.5-year survivor of breast cancer, joins me to talk about how she's helping other women battling the disease. Linda, welcome to the show.
Thank you.
You were 37, I believe, when you were diagnosed with stage 2 breast cancer. How did you learn about your diagnosis?
Well, it was very interesting. I actually was 37, as you mentioned, and you're not supposed to have breast cancer under the age of 40, let alone under the age of 50. And I had actually been in a very regimented workout and diet, and I had dropped a lot of weight, and I was very lean. I actually found it getting out of the shower, and I could see it actually protruding out of my left breast. One of the scariest things that I did, which I don't recommend anybody doing, is going, oh, I'm only 37, don't worry about it, because I did wait, and that was about October of 2004. I waited till December to go to the doctor, and almost didn't even go get a mammogram because, again, I was 37. So when I finally went in January, I went on a Monday. They told me to come back on a Wednesday for a biopsy on Friday. So from Monday to Friday, I was diagnosed with breast cancer with, as you mentioned, stage 4, and I was a triple positive.
So you were in basically good health and had an exercise regime and took care of yourself.
I was actually in the best health of my life at that moment. So it was kind of shocking to actually have a diagnosis.
That probably
breast
stood
cancer.
you in good thing for you at that point, because
I was actually very lucky. I was in as good a health as I was in, because that's how I found it so quickly. Again, being as lean as I was, it showed up. Some women with the type of breast cancer I had, very aggressive, moves very fast. They usually don't find out about it until they're stage 4 and it's already metastasized. So I was, again, very lucky that I did find it, and being so lean like I was and very healthy. And they were able to pretty well douse me pretty good with chemotherapy.
How was your treatment? What was it like for you?
It was an adventure. The first one, I'll tell you, it wasn't that bad. It wasn't pleasant, but I held everything together. Doing I had to go through 8 rounds of chemotherapy, so 8 sessions of it. The second one was really the most, what I would refer to as the most hellacious out of all of them, and that's where your hair falls out. That's when it's called adriamycin cytoxin. That's when it starts really affecting your hormone levels, and you get a little emotional.
The ramifications of so many areas in your health.
Yes, it just all comes to a head right then. It's like, okay, I've lost my hair. This is real. So there's four cycles of the adriamycin cytoxin, and then I went on to Taxol for another 4. Went to that every 2 weeks, and the last 4 were not as bad, just really tiring is actually what it was.
How did you find that encouragement to persevere through this kind of experience?
Well, when I was first diagnosed, there was nobody out there that was my age. That was the most difficult part. I'll be very honest with you. I actually met with the social worker, the oncology social worker at Florida Hospital, and I asked him, I said, well, where are all the young breast cancer survivors? He said, they're not around. I immediately said, they're all dead? And his answer, he chuckled back at me. He said, no, no, no. What happens is young women, they go through it, they get better, and they move on with their lives. And his comment back to me was, and that's a darn shame. And at that moment, I kind of realized my purpose is that I knew I had to one, fight it, beat it, be here, but also to be available for women, all women diagnosed with breast cancer, but mainly those that were diagnosed at a younger age.
Well, that's what I wanted to know. Why is it so important for you to share your story with other people?
I don't feel like there was a Linda around when I was diagnosed. I wish I had me to talk to. I probably would have made some different choices. And so I want to make sure I'm here for other women to talk to. I've been there, done that. I can tell you why I did what I did at that moment, and I can tell you what I would have done differently. I just want to be here as a beacon of like, okay, this is what it's like. This is life after breast cancer. I don't live it and breathe it every single day of my life anymore, but it's still there. And you can have a successful life afterwards. You can. I got a promotion while I was going through chemotherapy. I've moved on to a new career since I've been going through treatments. So I just want to be here as a beacon for these other women who may be diagnosed and facing it and scared, wondering, am I going to see tomorrow?
What's next?
And
yes.
what's next?
How can friends and family best support somebody that they love that's going through this?
That's a very good question because everybody's different. Some people, they want to have a lot of people around them. They want to be surrounded by friends and with family. Some people, they only want 1 or 2 or 3 people and they're very close to it. So it's an individual type of a thing. And really what you have to do is just say to the person, I'm here for you. Is there something I can do for you?
So ask them how you can be of help.
How can I support you? One thing I will tell you that was very valuable to me is I would get cards. There's one person in particular that actually sent me a cartoon every single day in the mail for the entire 8 treatments that I went through.
That's wonderful.
And just little things like that, and just knowing what someone's personality is like. And I'm generally very jovial, very laughing all the time. But just asking the people what would they like, what do they need. Sometimes they don't even know what they need, and one day it will be like, I don't need anything, and then click, oh, you know what, I need somebody to take me to treatment or something like that. So.
What would be your words of advice, any words of encouragement for women who are battling breast cancer right now?
This too shall pass. Just keep on putting on your pink gloves, fighting, doing your treatments. I know it's difficult. I'm dealing with one of my friends right now going through it for the 2nd time. And, every single day she wants to know why her. When you sit down and you think about that and your woe is me, you're just like, why me? There's one thing I always said to myself at that point is, why not me? So that's what you do. You have to put on those gloves. You have to have a positive attitude. Have your days where you're going to be sad and upset, because you got to have those. Get through them. Don't let them hold you back. Move forward, and just know it's going to be something in your past, something you're going to talk about 8.5 years later.
Thank you, Linda, so much for sharing.
Oh, thank you very much. Appreciate it.
When we come back, we'll learn how early detection can make all the difference for women with breast cancer. Dr. Nikita Shah is a medical oncologist at Orlando Health who specializes in breast cancer. Dr. Shah, welcome.
Thank you for having me.
What is the top tip, if you had to choose, what would be your top tip for early detection?
Don't ignore anything that does not feel right. We see that over and over again. Patients will say, but I just had a mammogram. How could I now have breast cancer? So if you feel something, even if you've had a recent mammogram that is normal, please don't ignore it.
So be accustomed to what's a baseline for you and let that be the trigger for when you need to have attention.
That is correct, and that's where we talk about the self-breast exam. Because until you know what your breast feels like, you won't know when there's something different. And that's why that monthly breast exam kind of gets you to know what your breast is like normally. So then if you feel a lump, you'll say, oh my gosh, that's new or different for me.
What does early detection do for survival rates?
We know that with early detection, the survival rate is over 95%. So that's why early detection is the key, because we know that if we can catch breast cancer early, we can cure it, we can never have it come back again.
That's a huge statistic, 95%.
That is right.
There are risk factors associated with breast cancer. Can you talk a little bit about what some of those are?
So there are a lot of risk factors, but there's not one which is, causally known to be the one risk factor. So some of the risk factors are you start getting your periods early, you go into menopause later, women who don't have any children, obesity. These are all risk factors. One of the other risk factors, if you have a family history of breast cancer. So sometimes we see clusters where there are 3 or 4 family members with breast cancer. That's where we think of genetic testing, the BRCA mutations. But remember, only 8% of all breast cancers are genetic, meaning about 92% of the times there is no reason why a woman gets breast cancer.
I didn't realize that. I thought that was much more of a prominent factor. What about age? How does that factor in with breast
So
cancer?
typically the incidence of breast cancer increases with age. So we hear more about the younger women with breast cancer, but actually the incidence increases with age. So at about age 30, a woman's risk of developing breast cancer is 1 in 2,000. By the time that woman is 80, it's about 1 in 9. So your risk increases with age, and that's why it is very important that once a woman hits the age of 60 or 65, they should not stop doing mammograms, because that's when you actually really need those screening mammograms to pick up that early cancer so you can have that 95% cure rate.
And I think that's a perception out there that a lot of women, when they reach a certain age, feel that it's not necessary any
anymore.
longer, when actually they're more at risk than others.
Then that's correct.
When a lump is detected, what would you advise? What's the next step that a woman should take?
So remember, about 80 to 85% of lumps are not cancerous. So just because you feel a lump does not mean it is cancer. But that also does not mean that you ignore it. So if it is something new, please have it looked at. So it's very likely that if a woman feels a lump, she'll be sent for a mammogram, usually a diagnostic mammogram. That's the one where they'll do additional views, they'll do an ultrasound. If something looks abnormally, the calcifications or the ultrasound looks abnormal, then a biopsy would be recommended. And then the biopsy would say whether this is cancerous or not.
Dr. Shaw, we've talked, a lump is not necessarily the defining factor. What are some of the other ways, and you were saying a baseline for a breast, what are some of the other things that can show that there's a problem?
So as part of the breast exam, what a woman should be doing is not just feeling for lumps, but looking at the breast. So if you're right-handed and you're looking at yourself in the mirror, your right breast will look a little bit bigger than the other. But if you've never seen that, that may look abnormal. So a change in the color of the skin, a change in the nipple suddenly gets inverted if you have nipple discharge, which may be clear, it may be bloody, it may be milky, but that's not a normal occurrence for most women. So if you have sudden nipple discharge, if you have puckering of the skin, the skin looks like an orange peel, these are all signs that there may be a problem.
What about for men? And that's not often discussed, but men do get incidences of breast cancer.
That is correct. 1% of all breast cancers are in men. And they're treated the same way, they behave the same way. Obviously, when I say treated the same way, they obviously have to have surgery, but it's always a mastectomy because there's not enough breast tissue. So in men, the most common presenting symptom is a lump. Occasionally nipple discharge, but because there's not much breast tissue, it's a lump that is felt prominently. And when we see men with breast cancer, it raises a flag that this could be associated with the BRCA2 mutation. Classically, male breast cancer is associated with the BRCA2 mutation.
How does early detection in patients, how does treatment differ for that patient if you can catch it that soon?
So when you catch it early and you do surgery, the cancer is gone. Everything you are doing beyond that is preventive therapy. Versus if it is caught late, meaning it may have already spread somewhere else, you're always one step behind. So you're never going to be able to cure the disease. So now you're looking from something that has a 95% cure rate down to the chances of making it cured are almost 0. So the treatment is very different. So we do aggressive therapy up front. We do chemotherapy, radiation, endocrine manipulation, and surgery. Maybe some patients may need all of the above in an effort to prevent the cancer from coming back.
There's been an increased push, I think, or awareness for breast cancer, both for education and other ways. Are you seeing less women now presenting with stage 3 or stage 4 than before?
Yes and no. I think we're seeing a lot more early stage, especially what we call stage 0 breast cancer, which is the DCIS, because we are picking up more with screening mammograms. But I think it's probably a combination of sometimes a little bit of I don't want to know, also the economy, not having adequate access to health care, is that patients are not going for their mammograms in time, or they're not going every year, they go every 2 to 3 years. So by the time a breast cancer is diagnosed, it is often later stage. So the ones that are going regularly, we are picking up early cancers, yes. But we are seeing a lot of patients not going annually.
Are there any myths that you would like to dispel about breast cancer? Misconceptions or?
Probably the big few ones are, I don't have a family history of breast cancer, so how could I get breast cancer? And I tell patients, somebody has to start your family history, and you are the one starting the family history. The other one is in women who do have the BRCA mutation. They think, oh, it's just a question of time before I get it, there's nothing I can do. No, there are a lot of things that you can do preventive. Removing the breast before you develop breast cancer, removing the ovaries before you get ovarian cancer. So there are preventive things that you can do. The other common myth is, antiperspirants, deodorants, again, no data on any of that.
What about diet or exercise? Does that factor in at all?
Well, we know that obesity is associated with a higher estrogen level that potentially can increase your risk of breast cancer. So we know that overall exercise and a healthy diet are good for you, and that same continues as far as you're reducing your risk for breast cancer.
What would be your top #1 piece of advice for women or men regarding breast cancer?
It is very treatable if caught early, and we recommend a 3-prong approach. So one is annual mammogram starting at age 40, and like I mentioned earlier, no upper limit. As long as a woman is in good health, she needs to continue annual mammograms every single year, no skipping at all. Number 2, monthly self-breast exam. Do your breast exam so you know what your breast feels like. So for women who are menstruating, the best time to do a breast exam is about 7 or 8 days after your period has ended. That's when your breasts are least lumpy, so you get a good feel for that. For women who are postmenopausal, it doesn't matter. Pick a day of the month and do your breast exam every month. Even for women who are nursing, we recommend that they should do a breast exam maybe right after a feed. And the third approach is an annual breast exam by a healthcare provider. So with these 3 approaches, you can really catch breast cancer very early and cure it.
Thank you, Dr. Shah, so very much. After the break, we'll talk with the local leader of an organization dedicated to breast cancer outreach and advocacy. Stephanie Steele is the executive director of Susan G. Komen for the Cures Orlando affiliate, which has raised more than $4 million to support breast cancer research, education, and treatment. Stephanie, welcome to the show.
Hi, thank you for having me.
What is the mission for Susan G. Komen?
Really, our mission is to end breast cancer forever, and locally, we're doing that through our local grant programs and research.
How is the organization making an impact across Central Florida?
Well, we are the largest non-government funder of breast cancer programs in Central Florida, as well as the largest research funder for breast cancer.
How did you get involved with this?
I started as a volunteer. It was just something I was really passionate about, and slowly kept coming back more and more. And when the opportunity became available to work for the affiliate, I jumped on it, and here I am today.
You have worked then for a number of years with the organization. Have you seen some changes along the way?
Absolutely. There's been a lot of changes, specifically in where we are with our programs. Our programs for breast cancer patients have gotten a lot better. We put a lot more checks and balances in them to make sure that patients have a smoother ride.
How do you work with families and the patients involved?
So we strive to be a support system for people here in the local community. Of course, we offer these resources, but we often get to know them on a one-on-one basis, to where they'll call me up and let me know how they're doing. And I mean, I get invited to birthday parties and things like that for the families of breast cancer survivors. And we really enjoy that. We want to be there for people.
Stephanie, what are some of the educational efforts that go into promoting early detection?
Absolutely. Well, one of the things that we are really promoting is to just know what's normal for you. A lump in my breast might be different than a lump in someone else's breast. So it's just important to pay attention to changes that are happening to your body specifically. So we really just promote people paying attention to what's happening to their body and any changes.
So almost saying you know your own baselines.
Absolutely.
And what deviates from that might be an idea that need to get a checkup.
Absolutely. Everyone knows about the lump and they associate that with breast cancer, but there are actually a lot of other symptoms that can indicate a risk of breast cancer, even itching in your breast. That can indicate potential breast cancer or potential risk, but people don't pay attention to those things because for so long we talked about the lump, but it's important to know about rashes, skin dimpling, your nipple turning inwards. There's a lot of different changes, so we sort of changed our messaging to look at the breast as a whole and pay attention to all things that happen.
Again, I think you're right. A lot of people aren't aware of the other risk factors or evidence of a problem occurring.
Absolutely.
Now, you mentioned some resources for the patient and for the families. What are some of the resources that you offer?
Sure. So what we do as a local affiliate is up to 75% of everything we raise, we keep it here in Central Florida. And we put it out into different programs in the community so that patients can have access to things such as breast health screenings, diagnostics, testing, education, and also financial assistance when going through breast cancer. We also have a lot of resources in support groups, as well as linking breast cancer patients to one another to lean on.
How critical is it for a patient to have the support of an organization like yours?
It's huge. Every patient that I have ever met has just been so thankful to know that there is a place to go for information, but also for a relationship of some type of support, to meet other people, to know that we're doing something to impact and make a difference in the breast cancer community.
How much does it help with the families? I would think that that's such an emotional time, watching a loved one battle breast cancer.
Absolutely. And a lot of people don't realize when your loved one is going through breast cancer, simple things like vacuuming, doing laundry, cooking, those types of things family need to pitch in for because women often can't move their arms after surgery for a certain amount of time. So we always try to educate family, just be there, do normal things. Everyday things make a difference. But also participating in some of our events and just getting behind our cause, it also empowers them to know that they are making a difference.
People don't realize all those aspects. Now, you talk about an educational aspect for the family. Do you have classes, or just is it a formal kind of thing that they can sign up for?
Absolutely. We've got all sorts of different things. Every year really varies based on what our community wants and what they ask for. We're often putting out surveys saying, would you like to come to an educational event? So we do a lot of breast cancer symposiums, as well as individual classes or education tents at events, things like that. Or we have a lot of people come into the office to learn things, and then they often end up staying as a volunteer.
So you do a lot of presentations as
yes.
well as just the informal, here's a table and some information.
Absolutely.
I didn't realize that.
Oh, we try to be everywhere. We are always open to go and speak wherever we can because we realize that's really the basis, that's where it starts, just having people familiar with what Komen does and also about breast cancer.
Now, I know that the Susan G. Komen chapter spans a 9-county area. How are you keeping up with demand for services?
Well, what we do is every few years we do what we call a community profile, and basically what that is a deep dive into Central Florida, where we're looking at statistics and what's happening to patients so we can see what are the gaps in breast cancer here in Central Florida and what do we need to do to make a bigger impact, because what we need to do here in Central Florida might be different from what Miami or New York needs to do. So we keep up with it every few years by looking at these numbers and just talking to our patients and providers to see what they need, and then we change our granting priorities based on that.
What about partnerships? Does Susan G. Komen partner with local groups too?
Oh, absolutely. I mean, we're partnering with people in different ways. So we do a lot of educational partnerships as well as sponsorships where we partner with bigger companies. They'll often donate, but we also go out there and we speak to their employees and tell them about breast cancer. We do screening events, partnering with all of our grantees, which is everything from health departments to homeless clinics to hospitals.
It sounds like you have a wonderful outreach. Now, you talked a little bit about your volunteer role to start with. How do people get involved with the volunteer aspect of Susan G. Komen?
I mean, often it's just a phone call to our office or an email saying, I want to be involved. Do you want to help? We've got things for people to help us with because there's so much going on. Our Race for the Cure that just happened, we had about 400 volunteers out there. So that's our largest event. But all through the year, we always need volunteers to help us with different things. So it's just a matter of getting in touch with us and letting us know you want to help.
Where can people go to learn more about the organization?
Sure, they can go to our website, which is just Komen, K-O-M-E-N, Central Florida, all spelled out, or we actually have a helpline. It's free. It's 1-877-GO-KOMEN. It can help point you to resources, but they can also talk to you about breast health as well.
Stephanie, thank you so much.
Thank you.
That's all for our show today. Visit wucftv.org/metro for interactive features, special content, and more. Thanks for tuning in. Until next time, I'm Diane Trees.